Today I'm going to talk about a simple thing that can make a big difference in the comfort of our feet. How to make our shoes more comfortable using techniques for lacing the shoes. Most people will say, what difference does a shoelace make? Well, it can make a big difference. It can take pressure off an area, such as a bony prominence or spur that's pressing on a nerve, and you can also use it to make the shoe fit more snug, or in other cases, more loose, depending on what you need. Today, what we're going to do, again, is demonstrate some of the things. So what I've done is, you can see here, I've removed the laces pretty much down towards the bottom. Now let's say a person has some type of bony prominence right there. This is a common area. It's at the first metatarsocuneiform joint, and we call it a saddle bone deformity. And it's basically an exostosis or bony spurring that sticks up. In most humans, there is a nerve that runs across there. So they get a compression pain right in that area. So one of the things we can do is we can cross till we get to the painful area. And so we cross the laces traditionally, either down at the bottom or one layer up. And then instead of crossing again, we start to weave straight up so that we're not crossing at that area. And we do that on both sides till we get to the point at the top. And then if we want to have it to snug the shoe, we can actually cross again at the top as long as there's not an area. So when we get up here, we can actually cross over again wherever the bony prominence is to avoid pressure on it. So we cross them here, and then you can tie them in the traditional manner. And what happens is with that, it still gets a snug fit to the shoe where it won't come off, and they still benefit from the pressure off. So now we've skipped the laces, and this has gotten pressure off of it. It also kind of widens the shoe at that point because there's no tension in there. So versus up in here where I can't push it apart, I can push the shoe sides across. And that again relieves the pressure. So that's kind of an easy thing we can do. We can also do it all the way up. Sometimes with people with swelling that have problems with tying their shoes because of they're swollen in their foot. Maybe it's temporary. Maybe it's permanent. And we can again lace that all the way up and even just tie it at the top. So again, that will give a kind of a total relief to the area so that we don't have that. You can also modify and not cross until the very, very last lace. And again, you want to protect this so that there's no irritation from any type of lace that goes across there. So if we take this down, for example on this one, we have it come across, and again, we've created now an area that gives a lot, that stays on the foot, because most people will look at that and say, how does that stay on the foot? But it does. And we can see now how that gives pressure. So if her foot was actually quite large due to ankle sprain, we see this sometimes in marathoners for a week or two, or somebody that just has lymphedema, venous stasis, or any other causes of swelling, this allows us to keep them in their shoe to give them support, but it'll take the tension off of the area and allow for expansion. That way they're not having the tendency to want to walk barefoot or in slippers that do not protect the bottom of the feet enough. Another thing that's commonly seen is in people who have unstable ankles or who tend to slip out of their feet is use what we call an ankle lock. And this is many times something that we use in athletes. Now it depends on your athlete and your pressure and the type of shoe. Some people don't like it. For myself, example, I don't like it, but that doesn't mean that it doesn't have a purpose. So when we have a traditional lace, there's usually a little slot over to the side. It can be another eye, or it can be like a little tab. And what you want to do is you want to run it in through that tab like this, so that it comes up the side. And then once we get it through there, we actually want to then tie it in the traditional manner. Now the advantage of that is it usually snugs it harder and tighter around the ankle. So some people like it for support, or in a lot of women, they have narrower heels than they do their front part of their foot. So if they buy a shoe that fits for up here, let's say they have a bunion or something, the problem is they may slide around in the heel. So what we do with the shoes is kind of cross them over, as I said, in their traditional manner. And you can also incorporate the other lacing technique I talked about if there's a bony prominence back here. But then when you get to the heel, you want to pull that up. You want to come around. And what this does is it pulls the collar. The collar is that top part of the shoe. And what you want to do is pull that down, and that pulls that forward. And you can feel that be a little snugger around there. So the thing is, they don't get slipping with their shoe. It puts it in there and locks it in there. That's why we call the technique a heel lock. Again, many runners, walkers, people with narrower heels than the front part of their foot really like this technique. And it's a very simple technique that can make a big difference. As I said at the beginning, it seems kind of silly that you think that shoelaces, most people will dismiss that and say, well, a shoelace is a shoelace. But there is different techniques that can make a difference and make your feet more comfortable in activities that you do.